Welcome to Lesson 4.1, Ethical and Human Rights Concerns in Global Health. So no doubt, whenever working in health, and specifically global health, we do come up against difficult ethical dilemmas when planning where to put healthcare resources or provide healthcare resources, when we implement global health measures, thinking about the cultural variations, and specifically in conducting research. And it's very important to remember that there's a strong connection between good ethical and human rights practices and good health outcomes. And I've definitely come up against ethical and human rights concerns during my work in northern Ghana. So as we progress through, you'll see I've written some notes in the notes section and also provided page numbers in the textbook. So ethical and human rights issues are extremely important in global health. There are specific international conventions and treaties that recognize access to health services and health information as human rights. And there are times when failure to respect human rights is often associated with harm to human health. Specifically health research. So health research with human subjects puts people at risk, oftentimes for the sake of other people's health. So oftentimes people are doing health research because they're experimenting with a new chemotherapy drug. And maybe the individual in the research study is not going to benefit from the actual chemotherapy drug, but you're doing it for the good of other people. But that's really important to think about when you're doing health research in low middle income countries and vulnerable populations, because you run the risk of it being a very ethical issue where maybe there's not the health literacy that's required for subjects to understand what they're getting themselves into. Health investments also must be made fairly because resources are limited. So when we're looking at investing in low-income countries or vulnerable groups, it's very important to look at where do we need to maximize our health investments and how do we do it fairly. So these are some of the important ethical and human rights issues that we see in global health. If we think about the foundations for health and human rights, one of the big treaties is the Universal Declaration of Human Rights. And there are other legally binding multilateral treaties as well, which you can read about in your textbook. Now, governments are obliged to respect, protect, and fulfill the rights they state, but they're not obligated to enforce them. And so, as a declaration, the Universal Declaration of Human Rights does not force the law. It can't force the law. But through a moral conviction, most countries will try to provide morally the health that people require, but they're not obliged to do it. And so resource poor countries typically are required to take the steps towards realization of positive rights. And that, there are provisions in human rights treaties and conventions that recognize that these poor resource countries, they're not going to be able to help all of their people achieve the highest standard of health possible. Instead, they are required, as I said, to take the steps towards the progressive realization of those positive rights. I want to talk a little bit about selected human rights issues. So the first one is the rights-based approach. And this approach is encouraging individuals in global health to assess all the health policies, programs, and practices in terms of their impact on human rights. So looking at all those. It also encourages groups to analyze and address the health impacts that may result or are resulting from violation of human rights. So, and to consider looking at what are those health impacts as a way to improve population health. And the priority is the fulfillment of human rights. So looking at the rights-based approach. But there are limits to human rights. There are circumstances in which someone's rights may be suspended. And we've seen this during COVID with respect to an outbreak of an emerging disease where we were we were prohibited from entering certain buildings. We had to wear a face mask. We had to socially distance. You couldn't congregate in large groups. And so there were circumstances where your human rights were suspended, and people fought against that. And we're also going to see where mandatory vaccination may be a human rights issue. But if we're going to suspend rights of individuals, they should be as narrow as possible, and the suspension should be carried out with due process and be monitored. We do see human rights issues with our HIV and AIDS individuals, and really any health condition that is stigmatized and discriminated against. And some of the human rights issues that we have to realize within these populations is we need to protect the rights of the individual who is being stigmatized and discriminated against with respect to employment, making sure they're able to go to school, that they are allowed to participate in certain social activities. We need to ensure access to care. There needs to be policies around testing, and then the protection of their confidentiality. So I want to speak to some of the terrible studies that have taken place with respect to research with human subjects. So we know research is essential for improving global health. However, we do recognize that most research studies do not benefit the people who participate in them. And so there are real strong ethical concerns about putting participants at risk for the sake of other people's health. And so I'm going to speak to a couple of historical studies that have been glaringly concerning and why we have certain ethical standards now. The first one of the key human research cases is the Nazi medical experiments. And these were experiments that were conducted on euthanized victims, prisoners of war, occupants of concentration camps. And they did many, many medical experiments. And the International Scientific Commission investigated and documented the abuses after war. And there were many individuals, many medical physicians that were put in prison because of that. And interestingly enough, there was research data generated through these medical experiments. And some of the information is still housed in Germany, and there's many questions on whether it is ethical to use the data that the Nazis generated. The second one is the Tuskegee study. And so this was a U.S. Public Health Service study, and they conducted a study on the natural history of syphilis in African American men. The study went on for 40 years, and the subjects were never given treatment. And thankfully, it eventually led to regulations for the protection of human research subjects. The last human research case I want to discuss is the short course AZT trials. So in the 90s, there was a lot of research looking at HIV. And one of the research areas was looking at preventing mother-to-child transmission of HIV. And it was found that a drug called AZT was very effective if given in the second trimester of a mother's pregnancy to prevent that transmission to mother-to-child of HIV. And it became the standard of care in high-income countries. Well, in the low-income countries, there was no standard of care, and HIV was the highest in these low to middle-income countries. And so researchers in high-income countries felt that it was not going to be able to be provided in these low-income countries because it was too expensive and too complicated to implement. And so a short course of AZT regimen was trialed in low middle income countries. And the concern was that why couldn't the standard of care that's provided in high resource countries be provided in low resource countries? And secondly, why was it that only a short course AZT trial was provided? Why not see if the regular course could be implemented in these low-income countries? And so there was a debated ethical double standard that took place, and the study still does remain controversial. So from these key human research cases came about some guidelines surrounding research ethics. The most common one, or the first document that came forward, came from the Nuremberg Code, and this came from the Nuremberg trials in which Nazi medical physicians were tried for the medical experimentation that took place. And so the Nuremberg Code specified ethical principles that should guide physicians engaged in human research. One of the biggest pieces of the Nuremberg Code is voluntary consent of the human subject is absolutely necessary, and that human subjects should only be involved in research if it is necessary for an important social good, and that it requires limits on and safeguards against risk to participants. The Declaration of Helsinki was brought about by the World Medical Association, and it developed ethical principles to guide physicians and non-physicians conducting biomedical research on humans. It's been the most influential and the most cited set of international research ethics guidelines. The Belmont Report is a U.S. National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research, and it identified basic ethical principles, specifically respect for persons, beneficence, and justice. So it identified these basic ethical principles that have to be incorporated into doing any research on human subjects, and it developed specific research guidelines. So in evaluating the ethics of human subjects research, clinical research protocols must now satisfy at least these 6 conditions. So this is a minimum requirement. There must be a social value, there must be scientific validity, fair subject selection, what's the acceptable risk-benefit ratio, informed consent, and respect for enrolled subjects. Specifically, research in low middle-income countries, the important issues when the subjects are likely to be poor, undereducated, and without access to good care is looking at what is the standard of care and why are we not providing it in these settings? What are the post-trial benefits? Are westernized medical groups simply swooping in and doing a research study and leaving, and that there's no benefit of this research being conducted in a low middle income country? And what's the ancillary care? What if they find something? Are they going to treat these individuals? Are they going to be sent to a healthcare facility? What if they find something else that they weren't initially looking for? So the importance of ancillary care. So if we look at human subjects research, the oversight today, in most countries, it's a legal requirement to undergo independent ethical review by a research ethics committee if human subjects are involved. And when I was conducting research in Northern Ghana, I definitely had to go through the ethics board within York University, but also my research proposal had to be sent to the ethics board within Ghana as well. There are safeguards in place against exploitation, but the regulations vary from country to country, which is can be unethical. And so you, as healthcare professionals, if you're conducting any research or being involved in any research project, you yourself need to think about your own ethical values. The last ethical issue I want to speak to is making investment choices in health. So it's necessary, especially in low middle income countries, because there are resources will always be fewer than needed to meet everyone's health needs. So how do you, as a non-government organization, make those ethical issues and investment choices in health? So as I said, the resources for these low middle income countries will always be fewer than needed to meet all the needs. And so choices must be made. And we make, in my work in Northern Ghana, we make these choices all the time. And so it's really important that the choices be made according to explicit, publicly justified criteria. So we always refer to the World Health Organization. There needs to be a cost effectiveness analysis, is really useful, but it's rarely sufficient. And judgments must be made about what is fair using a fair process. And so I can speak to more about this in our face-to-face classroom. Some of the principles for distributing scarce resources are: one is health maximization. So for my work in Ghana, we tend to maximize in certain areas. We know malaria is endemic, and so we try and focus on malaria. We did know that neonatal birth rates and maternal birth rates, the mortality rates were very high. And so we focused on the LIATA program, which I already spoke to, about looking at women ensuring that they are going to a healthcare facility to give birth, and then looking at that first month of life of neonates, how to resuscitate a baby, when to look for areas of concern if a baby develops pneumonia. Equity is hard. So we cannot treat everyone equally. We've already spoke to this. So equity is very hard. And so we tend to focus on mother and children. And then our second priority focus would be on young men who are maybe the breadwinners for the family. And so we focus in on their health is really important. We try and give priority to the worst off. And then this is not so much of a concern in Northern Ghana, but when you're looking at scarce resources, sometimes you look at personal responsibility. And that when they're thinking about personal responsibility, the principle is that lower priority should be given to people whose health problems may relate to their own health behaviors. Now, this is a little bit of a concern for me because if we are thinking broadly, we would think to the social determinants of health, and is it really someone's personal responsibility? So that's up for debate. A fair process is really important. And so there needs to be transparency about how decisions are made. You need representation from the affected stakeholders. And so that is one of the key things that the NGO that I'm involved in is we understand from the community. The community dictates to us what are their primary health concerns. And so that's really important. And again, the appropriate use of scientific data. So we'll go to the research and have an understanding that, yes, these are significant health issues. Women and maternal health and child health and young adult health, we can see from the scientific data that, yes, we're also seeing that, yes, it's happening in other low and middle income countries as well as Ghana. And what can we do? So some of the challenges for the future is that students of global health really do get insufficient exposure in their training to ethical issues. There are no mechanisms for enforcing human rights, as we already spoke to. There is a shortage of trained personnel for reviewing research. There's lack of reviews of how investments are made, and there really are some unsolved ethical problems. And so if you go forward into the global health world, you will come up against these ethical issues, and just go back to your own ethical values, your own moral conscience as a nurse, and they will guide you as you explore these ethical and human rights issues in global health.